You are listening to the Pregnancy Podcast with Vanessa Merton.
Hello, thank you for tuning into the Pregnancy Podcast. In today's episode, we're talking about what you need to know about the recent vaccine schedule changes. The CDC recently made significant changes to the childhood vaccination schedule, which has prompted widespread coverage and discussion. Vaccines are a complex and often polarizing topic. For expecting parents, clickbait headlines can feel overwhelming and confusing. So in this episode, I will break down how these recommendations are developed and what actually changed in the vaccine schedule. And you will learn how these revised recommendations influence pediatric care, insurance coverage, state requirements, and what this really means in practical terms as you are navigating vaccine decisions for your baby. You can find the full article and all of the resources for this episode at pregnancypodcast.com/vaccine schedule. Pregnancy Podcast Premium members get access to hundreds of episodes on every topic that you can think of for pregnancy, birth, and postpartum. And they are just as helpful now as when they were released. If you want reliable, evidence-based information, or you just want an ad-free experience without the stress of figuring out everything on your own, Pregnancy Podcast Premium has everything in one place. Check it out at pregnancypodcast.com/premium. When it comes to prenatal vitamins, the options can be overwhelming, and I have spent a pile of time looking into nutrients that matter most during pregnancy and which forms are optimal for you and your baby. My number one recommendation is the Zoller Prenatal Plus DHA, and that's because Zoller goes above and beyond in formulating their vitamin with high-quality ingredients, like the active form of folate, bioavailable iron, and essential nutrients like omega-3s. In the month of January 2026, save 40% off the Zoller Prenatal Plus DHA vitamin on Amazon with the code ZAPREN40. You can always check for the current promo code at pregnancypodcast.com/vitamin. Before we jump into exactly what changes were made to the vaccine schedule, it's important to understand how vaccine recommendations are developed and how they actually work in practice. In the United States, the Advisory Committee on Immunization Practices develops vaccine recommendations. These are based on a lot of factors, including the vaccine's safety and effectiveness, the severity of the disease that it prevents, and the disease's prevalence without vaccination. When determining vaccine timing, the ACIP is considering when a baby's immune system will respond most effectively, while also ensuring protection as early as possible. Then, the Centers for Disease Control and Prevention, the CDC, uses these recommendations to create the official U.S. immunization schedule. These organizations focus on protecting public health at a national level. These guidelines inform recommendations from professional bodies like the American Academy of Pediatrics, which in turn shape the advice that you receive from your healthcare provider. Typically, once a vaccine is added to the CDC schedule, it is broadly recommended, although implementation can evolve over time. If a vaccine is removed from the schedule, physicians' attitudes may change, although that shift isn't always immediate. Understanding how these recommendations are developed will help you have more informed conversations with your doctor, your midwife, or your pediatrician so that you can make the best decisions for you and your baby. As you're navigating vaccines for your child, you need to consider how vaccination policies can affect your family, and this depends on where you live. Although the CDC is a national organization, vaccines are not mandated on a national level. In the United States, every state has legislation that governs vaccine requirements, and states can enforce these laws by requiring proof of vaccination for kids to attend public or private daycare or school. In states that have vaccine mandates, a child may be denied entry to school if their vaccination records are not up to date, and that's how states can enforce vaccines. Currently, 29 states and Washington, D.C. allow exemptions for individuals with religious objections to vaccination. 14 states permit exemptions for religious, personal, or philosophical reasons. And 5 states do not allow any non-medical exemptions. I will put a link if you would like to look at your state's specific requirements and see what policies will affect you. Depending on your state, declining vaccines can affect your child's ability to attend school or daycare. In states like California, that's where I am located, vaccination requirements are strict, and it's difficult to enroll your child in school if they are not up to date with the CDC vaccination schedule. Families that choose to homeschool are generally not impacted by these restrictions. Now that you have some background information, let's talk about the actual changes to the vaccine schedule. Federal health officials announced this week that they were revising the childhood vaccine schedule and reduce the number of diseases covered by routine immunizations. Under the updated schedule, routine vaccinations now protect against 11 diseases. This is decreased from 17. The CDC has updated its immunization schedule to reflect these changes, and this is effective immediately. I will, of course, also link to the updated schedule. Under this revised framework, technically, no vaccines were completely removed. What the CDC did is that they organized childhood vaccines into 3 distinct categories. The first category includes immunizations recommended for all children, and this is where they decreased from 17 to 11. I'm not going to go into each of these in detail, but I do want you to know what this category includes. Vaccines recommended for all children includes DTaP, which protects against diphtheria, tetanus, and pertussis, which is whooping cough. It includes Hib, the pneumococcal conjugate, inactivated poliovirus, measles, mumps, and rubella, that's commonly known as MMR, varicella, which is chickenpox, and human papillomavirus, or HPV. The second category includes immunizations that are recommended for certain high-risk populations or groups. This does not apply to everyone. So this includes the RSV vaccine, which is recommended if the mother did not get the vaccine during pregnancy, and high-risk children, like those with a chronic lung disease, should receive a second dose. Hepatitis B is only recommended for infants that are born to women who tested positive for Hep B or whose status is unknown. You are routinely screened for hepatitis B during pregnancy, and if you test positive, you should be notified by your care provider. Dengue, this is not a common vaccine. This is recommended only if you live in an area with endemic dengue and if there is a laboratory confirmation of previous dengue infection. And dengue is not endemic in the United States. The meningococcal ACWY, this is recommended for high-risk groups, those with anatomic or functional asplenia or HIV infection, those traveling to countries with hyperendemic or endemic meningococcal disease, and first-year college students that are living in residential housing. Meningococcal B is recommended for high-risk groups, including those with anatomic or functional asplenia and during outbreaks. And lastly, in this category is hepatitis A. That is recommended for international travel to areas with endemic Hep A. These risk factors do not apply to most children. If your child happens to be considered high risk, if you live in an area where these diseases are more common, then you should be discussing that with your pediatrician. The third category includes immunizations based on shared clinical decision-making. These are vaccines that parents and healthcare providers decide on together based on individual circumstances. This includes the vaccines for the rotavirus, COVID-19, influenza, Hep A and Hep B, and the 2 meningococcal vaccines. One point that has caused a pile of confusion with these changes being rolled out is that no vaccines were fully removed from availability. Instead, some vaccines shifted categories or they shifted timing. All vaccines in all 3 categories remain available if you would like your child to receive them, and they are currently still covered by insurance. Now that you have the background and you understand what the changes are, why did these happen? These are not the first changes to vaccine guidelines during this administration. The CDC previously updated COVID-19 vaccine recommendations. They stopped recommending them for healthy children and for pregnant women. They also shifted the timing of the Hep B vaccine from birth, that was previously given before your baby left the hospital, to 2 months of age. After those changes, there had been a lot of speculation that more significant updates were coming, so this wasn't a big surprise. Federal officials have also said that one reason for revising the childhood vaccine schedule was a broader review of immunization schedules used in other developed countries. According to the U.S. Department of Health and Human Services, the United States is a global outlier in both the number of diseases included in its routine childhood vaccine schedule and the total number of recommended doses. So the revised schedule more closely resembles that of countries like Denmark, which immunize children against fewer diseases while maintaining strong child health outcomes. When thinking about this, it's also important to zoom out and look at the broader context. Vaccine skepticism increased nationwide in the wake of the COVID-19 pandemic. For many parents that had concerns about the COVID-19 vaccine and how that was handled, that influenced attitudes about other vaccines. So one possible goal may be to reduce overall vaccine skepticism by reducing the number of vaccines that are routinely recommended for all children. The public response to these changes has been mixed, as have responses from professional medical organizations. For many people, reactions depend largely on how these updates align with the broader views on vaccines. Political perspectives can also shape how these changes are received, particularly given that they were rolled out under the current administration. Robert F. Kennedy Jr., who is the Secretary of Health and Human Services, has been a polarizing figure in vaccine discussions. Some have characterized him as a longtime vaccine skeptic. Others view his approach and recent changes as a welcome shift in public health policy. All of this broader context has influenced how news outlets are communicating the updated schedule and how it is interpreted and discussed. Among professional organizations, the most notable response has come from the American Academy of Pediatrics. They have criticized the changes, describing them as dangerous and unnecessary. The AAP has stated that it will continue to issue its own evidence-based recommendations. And this response matters because the AAP plays a major role in shaping how pediatricians counsel families. As a result, many parents may continue to receive guidance that reflects the recommendations from the American Academy of Pediatrics, even as the CDC schedule evolves. And unfortunately, that can lead to differences in how these changes are implemented and the messaging that you receive. Given all of this, what are the key takeaways? Vaccines are a challenging and highly nuanced topic, and it is completely understandable to feel overwhelmed. especially when you're weighing potential risks, benefits, and unknowns, and you're considering all of this for your baby. I have spent hundreds of hours over the years researching vaccines, both for this podcast and to make informed decisions for my own children. And this is one of the most difficult topics to cover. It's critical for you to know that decisions about vaccines do not need to be all or nothing. It isn't a choice between declining all of them or getting every single one. In addition, you always have the option to delay vaccination. To make your decision-making process much more manageable, I encourage you to take these one step at a time. The very first vaccine for your baby is not recommended until 2 months of age. So if you're currently pregnant, you have a lot of time to think about this. I encourage you to focus on the vaccines that are recommended at your baby's next pediatrician appointment and to review them individually. This is a nuanced topic, and you should be considering both the science and the evidence as well as your personal context. I take a very systematic and evidence-based approach when I evaluate a vaccine, especially if I'm looking at it for my kids. My goal is to understand both the science and the context. So I start by asking several key questions. First, what are the risks of the illness the vaccine prevents? What is the history of the vaccine? What are the ingredients in it, and how effective is it? I also encourage you to consider other personal factors. This would include questions like, what is the likelihood of exposure where you live or in places that you plan to travel to? What's the overall health of your child? And is the illness more common during certain seasons? If you have questions about vaccines or you would like more information about specific vaccines, please shoot me an email, vanessa@pregnancypodcast.com. I am happy to dig deeper into the research and address listener questions in future episodes. And as always, I trust that you are discussing any questions or concerns with your pediatrician. My goal with this episode is really just to help you feel a little bit oriented and not be overwhelmed. These changes will continue to be discussed, interpreted, and implemented over time, but having a basic understanding of how vaccine recommendations are made and how they are actually used can help you navigate care with your pediatrician with much more confidence. The goal is really for you to make decisions based on evidence rather than fear, and for you to be confident in the choices that you make for your family. To recap today's episode, we talked about the recent changes to the vaccine schedule. I explained how these vaccine recommendations are made, how they can be enforced at the state level, and that the state that you live in may have some influence on your decisions about vaccines for your child. We talked about what actually changed with the schedule, and that technically no vaccines were completely removed, they were just reorganized. So vaccines are now in 3 categories. Category 1 is vaccines recommended for all children. Category 2 is vaccines that are recommended only based on risk factors. And then the third category is vaccines based on shared clinical decision making. All vaccines in all 3 categories still are available if you would like your child to receive them, and they are all still covered by insurance. I also explained a little bit of background on why these changes occurred and the thinking behind it, as well as the response from organizations like the American Academy of Pediatrics. Then we wrapped up with your takeaways. The biggest thing that I want you to know is that you have options. You can opt in to vaccines, you can opt out of them, you can also choose to delay them. Remember, the goal is that you are making a decision based on evidence and based on what is right for your family, that you are not making decisions based on fear. I would like to thank you for listening to the Pregnancy Podcast today. I hope that you find this episode helpful. If you would like additional episodes on vaccines, please let me know. Or if you have a suggestion for any topic that you would like covered on the podcast, shoot me an email at vanessa@pregnancypodcast.com. You can read the full article and see all of the resources that accompany this episode at pregnancypodcast.com/vaccine schedule. My number one recommendation for a prenatal vitamin is the Zoller Prenatal Plus DHA. And that's because Zoller goes above and beyond in formulating their vitamin with high quality ingredients. They base their formula on the latest scientific evidence, not outdated RDAs, which can lag years behind the research. Zoller uses high quality bioavailable ingredients like ferrochal iron. That specific form provides optimal absorption, it's gentle on your stomach, and it's non-constipating, which can be a big deal because constipation is already common during pregnancy, and some prenatal vitamins can actually make it worse. This is one reason on a long list as to why this is my favorite prenatal vitamin. In the month of January 2026, save 40% off the Zoller Prenatal Plus DHA on Amazon with the code ZAPREN40. You can always check for the current promo code at pregnancypodcast.com/vitamin. If you're looking for more evidence-based information, or you just want an ad-free experience, become a Pregnancy Podcast Premium member. When you sign up, you'll get access to the Your Birth Plan book. That is essentially a shortcut and a template to creating your birth plan. Plus, you get ad-free access to the entire back catalog and new episodes each week without ads. Check out Pregnancy Podcast Premium at pregnancypodcast.com/premium.